Hi, this is Dr. Vincent Rowe. You're listening to Interview with the Surgeon by the Surgeon Agent.
On this episode of Interview with the Surgeon, we welcome Dr. Vincent Rowe, Professor of Surgery at Keck School of Medicine of USC. He is both the Chief of Vascular Surgery Service and newly appointed Program Director of the Vascular Surgery Residency. Dr. Rowe is certified by the American Board of Surgery, with added qualifications in vascular surgery and a specialty training in endovascular surgery. He is a member of the Society of Clinical Vascular Surgery, Western Vascular Society, Peripheral Vascular Society, Pacific Coast Surgical Association, and the Los Angeles Surgical Society. He is a fellow of the American College of Surgeons and a distinguished fellow of Society for Vascular Surgery. He has held leadership positions in Western Vascular, Southern California Vascular, and Los Angeles Surgical Societies, and currently serves as a membership chairman for the Southern California chapter of the American College of Surgeons. He also serves as a senior editor for the vascular section of the e-medicine online textbook. Dr. Rowe has contributed to the surgical literature with over 80 peer-reviewed manuscripts, abstracts, and textbook chapters, and has made numerous scientific presentations at local, regional, and national meetings. Hello, everyone, and welcome to Interview with the Surgeon. Today we have Dr. Vincent Rowe. Dr. Rowe, how are you doing today?
I'm great. I've been doing really well.
Awesome. Thank you for joining us. Let's just get right after it. Obviously, this podcast is focused on providing education to residents and fellows. So thinking back to when you were getting started, what was your goals and aspirations during your residency, and how did those change throughout your fellowships?
So when I started my residency, my goal was to be a general surgeon. And I did my residency at Kaiser and Los Angeles on Sunset. And I actually liked their model of being able to take care of a large group of people, take care of them well, and a huge medical group. So I really thought that model was the way to go. And slowly I changed. And slowly I also felt that I wanted to specialize. It wasn't until about my fourth year that I decided that I wanted to do vascular surgery as a specialty, and that I wanted to think about pursuing a field more in an academic type setting. It was a shift that occurred when I would do rotations outside of Kaiser, like I did a rotation at Harbor, UCLA, a rotation at LAC, USC Medical Center. We would do those rotations to get exposure to some of the things that we didn't have. For instance, a lot of trauma patients didn't come into Kaiser, so we rotated over to LAC USC Medical Center to see that. And I just saw a different environment that pretty much motivated me to want to be in that environment. It was almost as if I was like a piece of coal, and I felt like I could be a nice piece of coal outside, but if I got into an environment that was on fire, a bunch of other coals on fire, then I would catch fire and reach my full potential. And that's what shifted in me around the fourth year. And I decided to go into vascular surgery, and I wanted to pursue a field of academics in vascular surgery. And that stayed with me ever since. I applied for my fellowship. Usually you apply a year in advance. I didn't make my final decision to go into vascular surgery until I was a fifth year. And so I had a year in between to basically not waste or what have you, but I had a year in between before I started my actual fellowship down at the University of Tennessee. And I thought about what to do. Could I just moonlight in some walk-in clinic and clip toenails, or actually get involved and continue to better myself? And so here at USC, they had these positions that were truly a junior faculty position, and you had a little bit more autonomy than a resident because you had finished your residency, but you did not have the board certification of a true certified specialist in surgery. And it was more of a 1 year time period for you to either just get an additional interest or to move on to your fellowship after that. And so I did that 1 year here at USC in vascular surgery. And it turned out that 1 year, I felt like I performed very well, so that after my fellowship, they recruited me to come back, and I've been back here ever since.
Now, speaking about that mentality, finishing up your fellowship, what was it that you were going through in the job search process? Were you set on coming back to USC, or were there other opportunities that you were going through, and how that perspective changed in the beginning years of your career?
Well, the job search was a lot of ups and downs. My original proposal was to stay at the University of Tennessee. My wife liked it there. I liked it. And they said no because they were waiting to take the gentleman after me. He had done his general surgery residency there and went away to do transplant and was then going to also do a vascular fellowship there. And they had groomed him for years. And they said, no, you can't stay because we're taking the guy after you. And so then I started looking around, and I went to a number of different places to interview. And I actually thought I had the job at Vanderbilt, and we were pretty happy. And then we went out and interviewed, went back, and they said, hey, you got the job. And then they called 2 weeks later and said you didn't. So that was kind of shocking, but I still interviewed around at academic places. And without getting in too much of the details, the recruitment to USC at that point picked up, and then I ended up back here.
Awesome.
But it was a very interesting process.
And that's really interesting too, to see how different people go through that process. Sometimes it works out in their favor in the beginning, and sometimes they go through a lot of different ups and downs, end up where they are. And just thinking, as far as what were some of the keys to your success that you attribute to your early careers, and how that kind of positioned you to be at the top of your game now?
I think that, people have, I think they have three things to lead to success. It's either, sweat, opportunity, and then inbred talent. And I guess if you have all three, then you end up like someone like Michael Jordan or whomever. But, if you're lacking in one, I think you can still be successful if the other two open up. And so for me, it was really sweat. I felt like I outworked a lot of people. I felt like I had some talent as well, but I wasn't the most talented. And so I could make up for that by working extra hard. And I think that's basically what set me apart was my work ethic. I really put everything I had into the profession. I put everything I had into the patients, and I've been relentless about it.
So seeing that you're dealing with, residents and fellows every single year, what type of advice do you have for them when they're graduating and they're thinking about entering the job market for the first time and kind of going through the things you went through? What are the type of things you guys discuss with them?
Well, I talked to them about the transition that they're going to take and the fact that they'll no longer have a supervisor or attending physician there with them anymore, and that they need to make sure that they are thinking independently even through this process of training. And there's no reason why they can't see a patient, and instead of just calling me and having me figure out the problem, they can just take 5 minutes and try to figure it out on their own and then call to almost get a validation of their thought process. So I try to make sure they're independent thinkers. I try to make sure that they're understanding that the time is short. So the people in their last year of training right now, I'm saying, okay, where do you feel the most uncomfortable? Is it taking care of patients with vein problems? Is it taking care of patients with, thoracic outlet problems? Where is it? And then you need to make sure you fill those gaps. I can't look at you and tell you where the gaps are. You have to tell me. And so I try to prepare them in all those ways, as well as prepare them for the knowledge that they need to have. And then give them the expectation that this is just the foundation and things will change. I tell them I wasn't doing this when I finished my fellowship. Now I'm doing it. I had to learn this along the way. So the journey continues, and it just doesn't stop at the end of the fellowship. It's a lifelong learning process, and they have to really be prepared for it.
Sure. Now, also, you're involved in some vascular societies. Can you talk about those societies and if there's any tools or resources for residents and fellows that they can access through that?
Yeah, the vascular societies help in that they provide a form of education, continuing education, and they also help network with people that have similar and like minds and interests in terms of the specialty and in some cases the hobbies that you may have. So I encourage the residents to get involved in the societies. I think they're good. Much people value them as they did when I finished. When I finished, the only way that you were going to see a group of colleagues at a particular meeting was to go to the meeting. Now you can see them on Facebook, every night. And there's chat rooms and there's Facebook groups and this and that and Twitter. So everything is a little bit different now. And it's hard to convince people that I have to pay this fee just to go to a meeting when you can just chat with them live anytime you want to in a particular group or discuss topics. So I'm not sure how societies will change, but it is a transition point right now for the newer generation, but I still try to encourage them to join.
I think that that's true too. A lot of things are virtual now. Like for instance, we're on Zoom. I know a lot of the National Society meetings this year have gone virtual. And when
Yes.
that happens though, and the residents and fellows don't have the opportunity to rub shoulders with each other or with professionals like yourself, what are you asking them to do? What are you telling them to do to be proactive and at least being able to reach out to the folks that they want to talk to?
Just be bold and find people that you need to talk to. You can't practice in a vacuum. And I try to tell them, the minute that you just close up and feel that you're doing everything right, you're falling behind because you're in that shell and you're not hearing what's new and what you need to implement. And you could do that for 2 years and all of a sudden you're way behind the curve. So I try to tell them you're either getting better or getting worse. And if you're not constantly getting better, then you're going to be falling behind, and that's not going to be good for your career. So interaction is very important, and interaction with your peers is very, very important.
So what would you say is the difference between interviewing for a residency match and fellowship match compared to the job interview process?
Well, I think it's very different because the interview for the match and to get a residency to go into medical school, you have all the documents in front of you. You have this test that you took so people have an idea of where you stand next to the other people. But now you're interviewing for a job. You haven't taken your board certification. And people just don't know. They have a case list on you, but they don't know where you stand in comparison to the other person. So somehow you have to make yourself stand out. You do have to sell yourself a little bit more. And you do have to be able to talk about what you can provide to that group or that academic institution with your skill set. What can you do for them? It's not now just, hey, what are you going to do for me to train me? No, now what are you going to give to them to make their institution, their group, their practice better? And so it's a little flip of a mindset that you have to be cognizant of, because you're now in a position to where you're interviewing for something that could last a lifetime or 20 years. And they want to know that they should invest in you and you're going to be someone that's going to deliver for them. So you have to kind of change your mindset. This isn't just a 4-year medical school or 3-year residency and I'm out. Now you're looking for something for more of a lifetime.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.